Mr. Cuomo, welcome. I want to thank you for your willingness to participate in today's hearing and for testifying in front of the Select Subcommittee more than 2 months ago. It took issuing a subpoena to get you to then agree to testify previously, so I appreciate you coming in voluntarily today. Before we get into the substance we are here to examine, I want to tell you that this subcommittee has been threatened twice this Congress. Once by the Chinese Communist Party through its embassy for examining the origins of COVID-19, and a second time by you through your counsel for examining the handling of COVID-19 in nursing homes. I can tell you, we have not and we will not bow to these threats. I certainly hope you do not approve of these tactics, or perhaps you aren't aware of them, Governor Cuomo, which seems to be a consistent pattern. Nonetheless, Select Subcommittee is holding this hearing today to examine your administration's handling of the COVID-19 pandemic in New York. Specifically, we want to focus on the issuance of a directive that resulted in the admittance and readmittance, according to the AP, of more than 9,000 potentially COVID-positive individuals to nursing homes. The Select Subcommittee has been authorized to investigate the COVID-19 pandemic and to explore lessons learned, positive or negative, to better prepare for future pandemics. Since the beginning of this Congress, we've been committed to conducting a thorough investigation, free from influence and unafraid to follow the facts wherever they may lead. We've acted in a transparent fashion, cognizant that Americans deserve to see our work and review all available information so they can draw their own conclusions. We're examining actions taken by Congress, including measures I voted for, but might want to do differently or better the next time, so that when the next shocking pandemic occurs, we have looked back, found what worked and what didn't, and established a workable system so that we may endure. This is an after-action review in hopes of being able to predict, prepare, protect, and perhaps even prevent the next pandemic. In search for best pandemic practices, today's hearing is focused on New York and the March 25, 2020 directive from the New York State Department of Health issued under Governor Andrew Cuomo's leadership. In this investigation, we have reviewed more than 500,000 documents, and we've conducted 10 transcribed interviews with members of your administration, including you. Our findings are based on the evidence and testimonies that we have received. This is a comprehensive and painstaking endeavor to find out what happened in New York nursing homes, with more than 2,000 pages of testimony publicly released to support our conclusions. Simply put, America cannot move forward without first looking back. And that includes examining your directive, Governor. Mr. Cuomo, I think you'll agree that New York State became ground zero for much of the pandemic in the United States. In the earliest stage of the pandemic, COVID-19 was a novel virus, and there was little information and a lot of unknowns. But it quickly became clear that COVID-19 was particularly dangerous for the elderly. We all saw the deadly consequences of COVID-19 in nursing homes in Washington State, the earlier epicenter of the pandemic. There was a 1,000-fold higher risk of poor outcomes, specifically hospitalization and death for older people relative to younger populations. Therefore, it was critically important that the public health response prioritize protecting high-risk populations. This is an important lesson learned. This was understood by the U.S. Centers for Medicaid and Medicare Services and the U.S. Centers for Disease Control and Prevention, the CDC. On March 13, 2020, CMS issued guidance, I want to stress the word guidance, that specifically directed nursing homes to not accept COVID-19 positive patients if they were unable to do so safely, and to only accept individuals if the nursing home could follow CDC transmission-based guidance. Again, this guidance was a non-binding, federally issued guidance that's reflected by its language. The CMS guidance used terms such as can and should, consistent with the tone of guidance. A nursing home can accept a resident, this is a quote, a nursing home can accept a resident diagnosed with COVID-19 and still under transmission-based precautions for COVID-19 as long as the facility can follow CDC guidance for transmission-based precautions. Nursing homes should admit any individual that they would normally admit to their facility, including individuals from hospitals where a case of COVID-19 was or is present. This was not the case with the directive issued by your administration on March 25, 2020. While I like to play semantics and refer to it as an advisory, it's clear that it's anything but. Merriam-Webster defines an advisory as containing or giving advice. Your advisory refers to itself in the language as a directive in the very first paragraph, with your name at the top, Governor Cuomo. And it says, this directive is being issued to clarify expectations for nursing homes receiving residents returning from hospitalization and for nursing homes accepting new admissions. Merriam-Webster defines a directive as an authoritative order or instrument issued by a high-level body or official. That's what that was on March 25, 2020. In your case, that carries the weight of all. Your directive uses words like shall, must, and prohibit. It directs that all nursing homes must comply with the expedited receipt of residents returning from hospitals to nursing homes. It directs no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. An authoritative directive from the state of New York with the authority of law. No resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. It directs that nursing homes are prohibited from requiring a hospitalized resident who is determined medically stable to be tested for COVID-19 prior to admission or readmission. See, here's the problem. Medically stable can still mean highly contagious. The language in this directive is not advisory and it's not non-binding. The CMS guidance was and still is advisory and non-binding. Directive with the authority of law supersedes guidance. Prohibited means not allowed, and prohibiting testing for COVID-19 is nowhere in the CDC guidance. Because of this language, the March 25 directive was dubbed a must-admit order by the public and press, and rightfully so. Those words are not in there, but that's how it became known in the common vernacular in the public and press. But your directive was not consistent with federal guidance, nor consistent with medical doctrine. You do not put highly contagious patients in with vulnerable patients subject to infection, and in this case, death. Your former commissioner of the Department of Health told us that you received the phone call from the Greater New York Hospital Association asking you to do something about nursing home residents that the hospitals wanted to be able to discharge. He testified that you were told that these patients needed to go home. And while you testified that you were not aware of the directive until April 20, 2020, you decided to keep it after learning about it. It remained in effect for almost 3 weeks after you knew about it. Governor, you own this. It's your name on the letterhead. This is your directive, whether you knew about it or not. You're the leader. The buck stops with you, or at least it should. It's important to look at your administration's record. 2 weeks after you learned about the order, your office changed the methodology of how nursing home fatalities were categorized. You removed out-of-facility deaths that occurred at the hospital, altering the full accounting of nursing home deaths. During your transcribed interview, when describing why you chose not to disclose the number of nursing home residents who died at hospitals, you remarked, "Who cares?" I'll tell you who cares about this. Doctors and nurses trying to save lives care about this. People dying and their families, they care about this. If someone contracted COVID-19 in the nursing home and died at the hospital, it matters. It is scientifically significant to know where, how, and why someone contracted COVID-19 and died if we're going to prevent this in the future. That is important data. In July of 2020, you released a report under the auspices of the New York State Department of Health that blamed nursing home employees rather than your directive for the deaths that occurred in nursing homes. Your spokesperson, Rich Azzopardi, described this report as peer-reviewed. I'm not sure if Mr. Azzopardi understands the peer review process. An effective response to the pandemic required a willingness to adapt to evolving data, to new information. It will be required for the next pandemic as well. It's important to review the data, actual data, to recognize the dangerous and disastrous consequences of your directive. A directive that goes against medical protocols and is considered by many medical professionals to be malpractice. You wrote in your book that it wasn't your, quote, place to filter or edit the truth, end quote. But it's clear that it seemed to be someone's place. You said, who cares? But we do care about the truth, because it's obvious that you don't, like the out-of-facility nursing home deaths. It's a truth that matters. And that's why we're here today. To ask why you made the decisions that you or your executive team made. To try and account for your actions and responses without naming and blaming others, as you have repeatedly done, because we need to help America be prepared for the next pandemic and to protect American lives. And because infectious diseases like respiratory viruses don't recognize borders, we want to protect lives beyond our borders as well. I look forward to a strong, on-topic discussion today